Imagine this. You wake up one morning, you brush your teeth quickly, and maybe you skip the flossing and rush to work. It feels very harmless. But here is the catch, and this is the shocking truth, that a bleeding gum that you ignore, that toothache that you put off, could actually double your risk of getting a heart attack. Yes, your mouth and your heart are deeply connected. Gum disease isn't just about losing teeth. It could cost you your life. Welcome to Wellness Health Talks. I'm Dr. Joshua Dirito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the link between gum diseases and heart attacks. What is gum disease and why is it of interest to us? Gum disease is the diseases that affect our gums, and it is normally called in medical terms periodontitis. It's a chronic infection of the gum, and the early signs include red, swollen, and bleeding gums when you brush or when you floss. If untreated, infection can spread deeper, and it will destroy the bone that is holding your teeth together, and then this will lead to loosening of the teeth. Globally, gum diseases affects nearly half of the adults, making it one of the most common chronic diseases. This could be surprising to you, but this is the reality. So, why is gum disease very important? Scientific evidence has shown that there is a relationship between the presence of gum diseases and the frequency and occurrence of heart diseases. So research shows that people with gum diseases are more likely to suffer a heart attack. How is this possible? A Harvard study showed that 28% of people with heart attacks had increased gum disease, and they also had an increased risk of a stroke. So then there was another Swedish study which is called the Paroflank, which found that gum disease raised a heart attack risk by nearly 50%. You can see this is like if you have gum disease, the chances that you are going to get a heart attack increase almost by 50%, which is very significant, and this is something that we might not be aware about. So why is this? So your gums are not isolated, they are connected to your bloodstream, and this connection then has impact on your body's inflammation, and this has impact on how your body responds to this. So how does gum diseases harm the heart? You might be asking yourself. Bacteria in the bloodstream. Bacteria like Papillomavirus gingivalis, which slip from the infected gums into the bloodstream, can have a significant impact on your body's inflammation. And it is this inflammation that causes the walls of the artery to undergo inflammation, and this leads to atherosclerosis. And as you have seen before when we have talked about atherosclerosis, it's a process whereby a normal blood vessel is like that. Then the vessel continuously throws the inside starts narrowing, and it progresses to a point that it completely closes down. That is a completely blocked blood vessel. So that process is hastened by the presence of these harmful bacteria that can come from your gums. So when atherosclerosis happens, then gum diseases boost the presence of inflammatory cells like C-reactive protein, interleukin-6, and even tumor necrosis factor. And these same markers are the ones that fuel heart attacks, strokes, and even clogged arteries. As I said, the blockage of the arteries, as you have seen. So what this happens is that when you have these gum diseases, this leads to weakened defenses of the body, and then oral infections weaken the immune system, making it harder for the body to protect the blood vessels. And what is the effect of this? More than heart attacks, what happens when you have gingivitis? Gum diseases are linked not only heart attacks, but people who have gingivitis and gum diseases are more at risk of getting strokes, getting atrial fibrillation, which is irregularity in the beating of the heart, and this also leads to increased chances of your heart failing and a higher cardiovascular mortality. Of course, when you have more heart diseases, then your chances of dying from heart diseases also go up. So this is a silent killer, because most people do not think that the bleeding gums is a big problem, and this is until it is too late. So what is the good news? How can we prevent this? Unlike the genetics, gum diseases is something we can control. This is something that is within our power, and we can do something about it. So what are some of the things that you can do to protect your mouth and thus protect your heart and also protect your brain? So brush 2 to 3 times in a day. Take time to brush your teeth, and make sure that you do it thoroughly. Then floss daily. This removes bacteria which brushing misses. And then having dental regular checkups. Then if you are a smoker, then it is highly advisable that you quit smoking, because smoking is the biggest risk for gum disease and also a big risk for heart attacks. So studies show people who breathe 3 times daily had 12% lower risk of getting heart failure, and also a 10% lower risk of getting arterial fibrillation. So oral health is not only a cosmetic issue. Yes, that good smile that you have is very nice, but it also has an impact on your cardiovascular health. It affects your heart and it affects your brain. So every time you care for your gums, you are not just protecting your teeth, you are also lowering your risk of getting life-threatening heart attacks. And this is a good news. So think about your toothbrush and floss as tools, not just for a smile, but for your heart's survival, because that is what it is. So the next time you see your gums bleed, don't ignore it. It could be your body's first warning that something is not right. It's not just your dental trouble, but it could be trouble for your heart also. So, and then start today. Brush, floss, and book that dental visit. Share this video with someone who always skips that dentist visit and who keeps ignoring that caries that she has. It might just save their life. And then don't forget to subscribe for more science-backed health insights from the Wellness Overall Health YouTube channel. Remember, a healthy smile also means a healthy heart, and there is a connection which is worth protecting. Thank you. We meet in the next video.